Most people, especially older adults, don't think twice about an itch. We assume it's dry skin, a new detergent, or maybe just the aging process. But what if your body is trying to tell you something more serious, something life-threatening? For seniors over 60, certain types of persistent itching may be the first sign of cancer. Not every itch is dangerous, but the location, duration and resistance to treatment could mean the difference between early diagnosis and a missed opportunity. This article uncovers 5 specific itchy spots that could indicate cancer, particularly in seniors, and explains how to distinguish harmless irritation from something more serious. These are warning signs your body whispers long before it begins to scream. 1. Persistent itching on the lower legs. Could it be lymphoma? One of the most overlooked signs of blood-related cancers like Hodgkin's lymphoma is persistent itching on the shins or calves. For older adults, this can be easily dismissed as dry skin or irritation. But here's what makes it different. The itch doesn't respond to lotion or creams. There is no visible rash, redness or flaking. It often worsens at night, disrupting sleep. Why does this happen? Cancers that originate in the lymphatic system affect the immune response, causing the release of inflammatory chemicals that irritate nerve endings under the skin. These chemicals don't affect the skin's surface, which is why it often appears completely normal. A 75-year-old man named George shared his story at a cancer awareness event. His only symptom for 6 months was an uncontrollable itch on the front of his legs. It wasn't until blood tests showed abnormal white blood cell counts that his doctor dug deeper, ultimately leading to a diagnosis of lymphoma. In his words, the itch came first, long before anything else. 2. Itching between the shoulder blades, a hidden sign of pancreatic cancer. An unusual itch deep in the upper back, especially between the shoulder blades, could signal pancreatic cancer. This might seem unrelated, but here's the surprising connection. As tumours grow in the pancreas, they can block the bile ducts, which help move bile from the liver into the intestines. When bile accumulates in the bloodstream, it releases bile salts that irritate nerves, especially those located in the upper back. This kind of itch is described as deep, internal and persistent, not relieved by back scratches, creams or posture changes, sometimes accompanied by fatigue, dark urine or pale stools. One woman, Linda, 70, described it as a phantom itch that wouldn't go away despite trying every home remedy. Eventually, blood work revealed elevated liver enzymes, and imaging scans found a tumour in her pancreas pressing on her bile duct. That itch turned out to be her only early warning sign. 3. Itchy scalp without dandruff, a clue to leukemia or skin cancer. For seniors, an itchy scalp is often chalked up to aging skin or a reaction to shampoo, but when the itch is persistent, tingling or burning, and there are no flakes or visible irritation, it could be much more than skin deep. In some cases, this is an early indicator of leukemia, where abnormal white blood cells trigger inflammatory responses. Skin cancer, especially in areas with thinning hair. The telltale signs of a cancer-related scalp itch include a crawling or burning sensation that shifts around, no relief from dandruff shampoos or moisturizers, worsens over time and feels internal. Henry, 73, noticed his scalp itching every afternoon. He tried changing hair products, thought his hat might be the cause, but nothing helped. A routine blood test for unrelated fatigue showed high white cell counts, and further testing revealed early-stage chronic lymphocytic leukemia. The scalp itch had been his only clue. 4. Itching in the chest or breast area. Could it be inflammatory breast cancer? Persistent itching around the breast or chest, particularly near the nipple or under the breast, can be one of the first signs of inflammatory breast cancer, a type of cancer that doesn't always produce a lump. Symptoms include warmth or irritation in the same area daily, skin that appears slightly rough, thickened or reddened, and an itch that doesn't go away with moisturizing or bra changes. For men, this warning sign is even more easily missed. While male breast cancer is rare, it still occurs, especially after age 60. An itchy patch, slight dimpling or soreness in the chest region should be investigated regardless of gender. Ruth, 69, had been battling a mysterious itch near her right breast. After months of trying different bras and soaps, her doctor noticed subtle skin dimpling and ordered imaging tests. They discovered a small aggressive tumour that hadn't formed a traditional lump. Without the itch, it might have gone unnoticed until much later. This symptom can also be linked to swollen lymph nodes under the arms or collarbone, suggesting nearby lymphoma or breast malignancy. Pay attention to this itch, especially if accompanied by a sense of tightness, swelling or heaviness in the area. 5. Genital or anal itching. Itching in the genital or anal area is among the most overlooked symptoms, largely because of embarrassment. However, chronic, localized and resistant itching in this region can be a red flag for media. Close-up of a medical examination, healthcare professional examining a patient, anal cancer, vulvar cancer in women over 60, and penile cancer in men. Unlike common skin irritation, this itch persists for weeks or months, feels raw, burning or deep-seated, and isn't relieved by hygiene improvements or over-the-counter creams. Eugene, 76, believed he had recurring hemorrhoid irritation for nearly a year. It wasn't until he visited a colorectal specialist that a small lesion on his anal canal was found, an early-stage tumour. Similarly, older women may assume postmenopausal dryness is to blame, but persistent itching in the vulvar area deserves a closer look. Why these itches matter more in older adults. As we age, our body changes the way it signals distress. Pain may be delayed. Swelling may go unnoticed. But the nervous system still sends messages, and one of the most consistent ones is itching. For seniors, the stakes are higher. Delayed symptoms mean cancers are often caught in later stages. Immune response changes can mask common inflammatory signs. Early detection is crucial, but it starts with listening to small clues. These 5 itchy zones, lower legs, upper back, scalp, chest and genitals, aren't random. They represent nerve-dense regions or lymphatic hotspots where internal problems are often felt before they are seen. When to see a doctor? If you or a loved one over 60 is dealing with any of the following, it's time to speak up. Persistent itch lasting more than 2 to 3 weeks, no visible rash or skin irritation, itch that doesn't improve with normal treatments, nighttime worsening or itch in the same exact spot daily, and accompanied symptoms like fatigue, weight loss, night sweats or dark urine. It's not about panicking, it's about being proactive. Mention the pattern to your doctor. Ask for a full blood panel and don't be afraid to request further imaging or biopsy if something feels off. Final thoughts. The body whispers before it screams. Many cancers in older adults don't start with pain or lumps, they start with itching. That's your body's whisper. And if you listen early, you might prevent something from becoming irreversible. An itch doesn't mean cancer, but a deep, unexplained, unrelenting itch in one of these key areas just might be the early clue that saves your life. You deserve answers. You deserve peace of mind, and above all, you deserve to live with confidence that you're listening to your body when it matters most.